The foot bone is connected to the leg bone is connected to the thigh bone. Oh, just kidding. But what if you actually can identify every single one of these bones in an anatomy exam? In this video, we are going to simplify the bones of the lower limb from the pelvic girdle all the way down to the bones of the foot. We'll cover the hip bone, femur, tibia, fibula, patella, tarsal bones, and their important landmarks, articulations, and muscle attachments. And by the end of this tutorial, lower limb anatomy will make a whole lot more sense. In medicine, confusion causes marks and mistakes cause life. Stop memorizing, start understanding. This is Dr ABM. Your medicine finally makes sense. Moving on. Now, the overview of the lower limb skeleton. It's important to know that the skeleton of the lower limb can be divided into two major functional components, the pelvic girdle and the free lower limbs. The pelvic girdle connects the lower limb to the axial skeleton, so this is the pelvic girdle here, and then from here downwards is the free lower limb. The pelvic girdle connects the lower limb to the axial skeleton, and it forms a strong bony ring known as the pelvic ring that is made up of the right and left hip bone and the sacrum. We'll start by looking at the hip bone. So the hip bone is formed by fusion of the ilium, the ischium, and the pubis. So you have them in red here. The hip bone has three major articulations. Posteromedially, it articulates with the sacrum at the sacroiliac joint. Anteromedially, it articulates with the opposite hip bone at the pubic symphysis. And laterally, it articulates with the femur at the hip joint. We'll start by looking at the ilium. You can see this, the ilium superiorly. The ilium is the largest of the hip bones, the broadest, and the most superior part of the hip bone. It consists of a body and a wing called the ala. So this is the body and the wing. The iliac crest, which you can see, extends from the anterior superior iliac spine. So these are the spines and the spines, and this is the iliac crest here. So the iliac crest extends from the anterior superior iliac spine to the posterior superior iliac spine, just behind. Then it serves as an important attachment site for muscles, fascias, and ligaments. The lateral source or the lateral surface contains the posterior gluteal line, the anterior gluteal line, the inferior gluteal line. This serves as an attachment point for the gluteal muscles. It's very, very important. Then the auricular surface or the medial surface of the ilium contains the iliac fossa, where the iliacus muscle attaches. The auricular surface, the air-shaped surface, articulates with the sacrum to form the sacroiliac joint. So important spines of the ilium include the ASIS, anterior superior iliac spine, and then anterior inferior iliac spine. Then we have the posterior superior iliac spine and the posterior inferior iliac spine, right? The anterior superior iliac spine serves as attachment for the inguinal ligament and the sartorius muscle. The anterior inferior iliac spine serves as attachment for the rectus femoris and the iliofemoral ligaments. The posterior spines, posterior superior iliac spine and posterior inferior iliac spines, are usually associated with the sacroiliac ligament and the multifidus muscle. Now we'll talk about the ischium. The ischium forms the posterior inferior part of the hip bone, so you can see the ischium here. The ischium has a spine called the ischial spine that serves as attachment for the sacrospinous ligament, the superior gemellus muscle. Then it has a lesser sciatic notch that is located inferiorly to the ischial spine. And then it has an ischial tuberosity. The ischial tuberosity is the bony skeleton that we sit on. This rough prominence bears the body weight while sitting. It also serves as attachment for the hamstrings, the hamstring muscle. Check out our video on the muscles of the thigh and the leg, and the inferior gemellus muscle. So the ischial tuberosity is for sitting and a site of attachment for the hamstrings and the inferior gemellus. Moving on, we'll talk about the pubis. The pubis forms the anteromedial part of the hip bone, or we just say the anterior part. The pubis has a pubic symphysis where two pubic bones meet anteriorly. It's a fibrocartilaginous joint. Then it has a crest, what we call the pubic crest, that serves as attachment site for the abdominal muscles and the inguinal ligament. Then the acetabulum and the obturator foramen. This is the acetabulum and this is the obturator foramen. The acetabulum is a cup-shaped pocket or socket of the hip bone that articulates with the head of the femur. So the obturator foramen, on the other hand, is a large opening that is bounded by the pubis, the ischium, and the rami. The obturator foramen is usually covered by an obturator membrane. This is the pubic symphysis, where the two pubis meet. Again, the iliac crest and the spines, the anterior superior iliac spine, anterior inferior iliac spine, and then posteriorly you have them. Very, very important. Now, it's important to know that the three bones, ilium, ischium, and pubis, are regarded as the cosa vera. We'll talk about the femur. Now, it's important to know the femur is the longest, strongest, and heaviest bone in the body. Its function is primarily to transmit the body weight, forms the hip and the knee joints, and provides muscle attachment. Now, we'll start by looking at the head of the femur, the proximal femur. The head of the femur articulates with the acetabulum, and it contains the fovea capitis for ligament attachment. The neck of the femur connects the head to the shaft. Then you have the greater trochanter, which is a large lateral projection for attachment of the abductors and the rotators. Then you have the lesser trochanter here. It serves as an attachment site for the iliopsoas muscle. Then you have the intratrochanteric line and crest. It connects the trochanters anteriorly and posteriorly. Now we'll come to the shaft of the femur. The posterior surface contains the linea aspera posteriorly, and the rough ridge provides attachment for the adductor muscles. Again, this is the head, this is the proximal femur, the head, the neck, the greater trochanter, the lesser trochanter, the intratrochanteric crest, the gluteal tuberosity, the pectineal line, and the linea aspera. About the distal femur contains the medial condyle, the lateral condyle, medial condyle, then the medial epicondyle, and the lateral epicondyle. Very, very important. It has a patellar surface that articulates with the patella, and has an intercondylar fossa that separates the condyles posteriorly. Moving, we'll talk about the patella. The patella is the largest sesamoid bone in the body. It primarily functions to protect the knee joint, and it increases the leverage or the actions of the quadriceps. So you see the base, and that's an apex. It has a medial facet posteriorly and a lateral facet. Next up, we'll talk about the tibia and the fibula. So the tibia is the major weight-bearing bone of the leg. The tibia lies medially, while the fibula lies laterally. The tibia articulates with the femoral condyle. It has an intercondylar eminence that contains the medial intercondylar tubercle and the lateral intercondylar tubercle. So the tibia tuberosity attaches or serves as an attachment, a site of attachment for the patellar ligament, and then the soleus lines, you can see, serves as attachment site for the soleus muscles. Then you have the medial malleolus, which forms the medial prominence of the ankle. Also for the fibula does not bear significant weight. It serves mainly for muscle attachment. The head articulates with the fibula, and it has a lateral malleolus that forms the lateral ankle prominence and extends lower than the medial malleolus. Moving on, we talk about the bones of the foot. Now the foot is divided into tarsals, metatarsals, and phalanges. The tarsal bones are 7. You have the talus, you have the calcaneus, you have the navicular, cuboid, and the 3 cuneiforms. The talus articulates with the tibia, fibula, calcaneus, and navicular. The calcaneus is called the heel bone, is the largest tarsal bone, and it forms the heel. The navicular is a shaped bone that looks like a boat, so we call it a boat-shaped bone. Contains the navicular tuberosity. The cuboid is cube-shaped, and then the 3 cuneiforms are the medial, intermediate, and the lateral. Then you have the metatarsals, 5, and you have the phalanges. The phalanges are 14, 3 on each toe, except for the big toe that has 2. In summary, the pelvic girdle connects the lower limb to the axial skeleton. The hip bone consists of ilium, ischium, and pubis. The femur is the longest bone. The tibia bears the body weight. The fibula mainly supports muscle attachment. The patella improves quadriceps efficiency, and the foot contains the 7 tarsal bones. And that's it for the bones of the lower limb. If you understand the pelvic girdle, femur, tibia, fibula, and the foot bones, then you've already mastered one of the biggest anatomy topics in musculoskeletal anatomy. Now that's how this concept should be understood, clear, precise, and exam ready. If this helped you, go ahead, like the video, drop a comment, and tell me what topic you want next. This is Dr. ABM, where you don't just study medicine, you master it.